What's the issue that you care about?
There's kids with needs.
Okay.
And they need a lot of help.
Organizations from AARP, AMA to YWCA and everything alphabetically in between, Children's Catholic Health Hospitals, are out there advocating for an override of this cruel veto. In a couple of days, in 48 hours, Congress will have a choice between meeting the needs of America's children or not. And not means that states who are already making plans to remove children already enrolled in SCHIP from the rolls. That is totally unacceptable. Because of the bipartisan nature, because of the bicameral agreement that we have great strength. Time will tell, 48 hours, as to whether we will override the veto. But no matter what happens then, we will continue to fight to ensure 10 million children.
Understand, everyone, understand, this is not a Democratic proposal. This is a bipartisan bill. And for those that talk about compromise, that's what we've done. That's how we were able to get the bill to where it was. That's why we have 69 members of the United States Senate who have stepped forward and support this legislation. It is a compromise, and we are confident that the compromises that we've made have been good for the American people and America's children.
The way this program came into existence is a couple of families from Provo, Utah, came to see me. Both husbands and wives worked in both of the families. Neither family earned more than $20,000 a year in combined income. They clearly could not qualify for Medicaid for their children, and they didn't make enough to pay for health care. So we devised this program as a program for the working poor families and children. And frankly, it has worked tremendously well. Virtually everybody, including the president, says it's a good program. The question is, and by the way, the original program had some flaws in it that we have improved with this program, with the help of our colleagues on both sides, but especially in the House of Representatives.
20 years ago, I co-founded the Children's Health Fund with Dr. Orrin Redlener. Our organization provides mobile medical units with doctors and staff to serve the pediatric needs of poor communities across the United States. In the 20 years since we began, we've grown incrementally, but as of last year, we had recorded over 1.2 million doctor-patient visits. The President's veto of the reauthorization of the SCHIP appears to be a heartless act. I'm here today to ask those of you who supported the veto to re-examine your conscience, to find compassion in your heart for our most vulnerable and sweetest citizens, our children. I am asking you to change your vote. If you do, I believe it will be one of the proudest days of your life.
President Bush said any American can get health care. They just go to their local emergency rooms. Just go to the emergency room. I'd like to take the President on a tour of America's emergency rooms, which are dangerously overcrowded. They're filled to the rafters with children and adults who should be getting their basic health care in doctors' offices and good clinics. Children need to be followed carefully and closely with preventive health care and health information and education. And the second misconception that I'd like to deal with is that the SCHIP program is for the poorest of our poor children in America. That's just wrong. It was designed to deal with the children of low-wage earning, middle-class Americans who simply make too much money from Medicaid, which is the safety net program for the poorest kids, who don't make enough money to buy private insurance in the private market, and whose employers do not provide them with the health coverage they should need. Nobody's interest, nor any view of America's future, can tolerate a failure to provide health care for our children.